We turn now to Sudan. After years of conflict, the new Republic of South Sudan is working to tackle many health challenges, including malnutrition. I recently spoke about this with Victoria Jabei Olusai, the Director of Nutrition for the Ministry of Health.
What happened was that I actually joined in the ministry in 2004 before the signing of the peace. And I found that at that time, the nutrition response was more from the international community because of the crisis of humanitarian crisis of malnutrition in the country.
What did you see as the issues in terms of nutrition where you needed to focus?
First of all, the prevalence of malnutrition in the country has never come down below the alarming figures of like 20% of global acute malnutrition among children under 5. This has been confirmed so far in like 2 demographic health surveys. In 2006 we had one, in 2010 we had another one. We are also challenged with a lot of other cross-cutting issues that cause malnutrition.
Such as?
Food is a problem, food intake, because at the household level many communities are food insecure. Food production capacity is yet to pick up. It goes with the season. When there's a season, there is usually the season of plenty and the season of the lean season. So during the lean season, there is a lot of hunger, and you see that the children are more malnourished during this time. But also we have issues of insecurity, population movements, displacement and so on. They cannot be active in producing food and also in maintaining their livelihoods. Then we have the issues of poor health services in terms of the provider. We still in the ministry are struggling with how do we improve on our health services. We still have a huge challenge of infrastructure, challenge of human resource capacity. What we are offering is yet too much below the needs of the people. This is then made worse by the fact that on the demand side, the health-seeking behavior is very much influenced by a lot of issues like lack of knowledge, harmful practices and all these things. Lack of hygiene and sanitation. People have very low access to clean or safe water. And then on the food side, you have the issues of prices escalating. The global economic crisis is even harder on the countries like South Sudan, where already the economy is really still to pick up. Most of our communities depend on imported food. And imported food means that there will be high taxes and therefore the prices will be high, and so the local person cannot afford.
What would you say are the steps that need to be taken or that you are advocating for to help solve this crisis?
We advocate actually to address the root causes, because if we don't, then we are just solving the symptoms. We still have the challenge that we need to move from the emergency approach to start looking at what are the problems which are causing the malnutrition. So one of my core roles is to really strongly advocate for the government to take this up at a much more higher development agenda level, because we can't even leave nutrition to the Ministry of Health only. Ministry of Health will treat after malnutrition has happened. What good will a message do if, for instance, you are talking to a community where there is no food production, for example? So we need the Ministry of Agriculture in place. And also the root causes are in the community. Most of those problems are also behavioral. You want to change the attitude, you want to change the behavior. So you want to impact knowledge on the communities. So Ministry of Education also to step in, starting to, changing generations through the curriculum. There are different ministries that need to play a role. So we need to influence the mindset of the government with adequate political commitment. It's my hope that from the Ministry of Health we will take it to the level of our president to understand that there are so many things out there that if we don't address it with a multi-sectoral approach, we will not be able to cut down the problems of malnutrition. And we need to let them also see the consequences of not addressing malnutrition in the long term. Not only to see that children getting malnourished today, what impact does it leave on them, and their intellectual ability, on their future participation in the economic growth of the country. And that's really my greatest priority at the moment.
And that's all for today.
Yeah.
Vincent?
Thank you very much, Linord, for joining us today with those very, very helpful health stories. And remember to join Linord Moudou every Tuesday and Thursday for the latest health news in Africa right here on In Focus.